Did you know that itching in certain parts of your body could be a silent warning sign from your body about cancer? Many of us ignore a little itch here and there, thinking it's just dry skin or irritation. But for older adults, especially those over 60, itching in specific areas might mean something much more serious. In this video, we'll explore 5 specific places where persistent itching can show up months before any other symptoms. These are not random itches. Doctors have noticed these patterns repeatedly in patients later diagnosed with cancers like lymphoma, pancreatic cancer, and breast or skin cancer. Stay with me till the end, because you'll learn why these areas itch, what cancers it may point to, and how to tell the difference between harmless itching and something you should not ignore. Remember, this isn't about causing fear. It's about paying close attention. The earlier you notice these subtle signs, the better your chances of catching something early before it becomes harder to treat. So let's begin by looking at the first important sign. One of the earliest signs that often gets overlooked is a deep, ongoing itch on the lower legs, especially the shins and calves. If you're over 60 and notice an itch that won't go away, with no rash, no dryness, and no new soaps or lotions involved, it's easy to dismiss it as just aging skin. But this persistent itch can sometimes be a warning of blood-related cancers, especially lymphoma. This is an itch that comes and goes. It stays and often gets worse at night. Unlike dry skin, it doesn't get better with lotions or creams. The reason lies in how cancers like Hodgkin's lymphoma affect your immune system. These cancers start in the lymphatic system, which helps defend and drain your body. As the cancer grows, it releases chemicals that cause inflammation in the blood. One common effect is a burning, deep itch in the lower legs. Even when the skin looks normal on the surface, the nerves beneath are being irritated. Take George, a 75-year-old man, for example. For 6 months, his only symptom was an uncontrollable itch on the front of his legs. His doctor first thought it was eczema or a detergent allergy, but blood tests showed abnormal white blood cells, and scans found swollen lymph nodes in his chest. The itch came first, well before any other signs. While not every itchy leg means cancer, the difference is how the skin behaves. If you have no rash, no bug bites, no new soaps, and the itch lasts weeks, especially with other symptoms like night sweats, fatigue, or weight loss, it's time to get checked. For older adults, being aware of this is very important. As we age, our bodies might not show obvious signs like pain or lumps early on, but nerves still react. A deep, restless, persistent itch is often the body's first warning. If you or someone you know scratches their legs nightly and creams don't help, don't ignore it. See a doctor, ask for blood work, and mention the itch pattern. Sometimes the body whispers long before it shouts, and listening can save lives. Now that we've talked about persistent itching on the lower legs, let's shift our focus upward to a place many people don't expect: the upper back, right between the shoulder blades. There's a particular itch that happens deep in the upper back, right between the shoulder blades, which is often ignored or blamed on posture, dry air, or even an itchy tag in a shirt. But for many older adults, persistent itching in this exact spot, especially when it feels like it's coming from under the skin, has been connected to pancreatic cancer. At first, it might seem strange that a problem inside the body, like pancreatic cancer, causes itching on the back. Here's how it works. Pancreatic tumors can grow and block the bile ducts. These small tubes carry bile from the liver to the intestines. When the bile flow is blocked, bile salts build up in the bloodstream. These extra bile salts irritate nerve endings, often in areas like the upper back, which is a dense network of sensory nerves. For example, Linda, a 70-year-old woman, shared that she had what she called a phantom itch on her upper back. She would wake up scratching it every night, but nothing helped. Not lotions, back scratchers, or even a new mattress. Blood tests showed her liver enzymes were high, which led to scans that found a small tumor pressing on her bile duct. The scary part? That itch was her only real symptom. No pain, no yellow skin, just a deep, nagging feeling she couldn't get rid of. She caught it early because she spoke up, even though it felt like a small problem. It's important to note that general back itching can come from dry skin or pressure, but if the itch is focused in one spot, doesn't improve with skin treatments, and comes along with darker urine, pale stools, or fatigue, it might be a sign of something deeper. The back becomes the body's messenger. Even when the issue is inside the gut, older adults often dismiss these subtle signals, but your body is wiser than you realize. When it sends the same message again and again, even if it's just an itch, it's worth paying attention. Moving from the upper back, let's now focus on a place many might not immediately connect with serious health concerns: the scalp. An itchy scalp might seem like a minor annoyance. Many older adults blame it on dry air, aging skin, or even shampoos that don't agree with them. But when the itching becomes persistent and there's no dandruff, redness, or flaking, it could be an early warning sign of something deeper. This includes blood cancers like leukemia or skin cancers that affect the scalp. This itch often feels different, more like tingling, crawling, or burning, rather than simple dryness. It might move from one spot to another and usually doesn't respond to typical treatments like anti-dandruff shampoos or moisturizing oils. For people over 60, these sensations can be caused by nerve irritation due to abnormal immune activity. This happens when leukemia cells multiply in the blood and disrupt how the body controls inflammation. Take Henry, 73, for example. He noticed his scalp started itching every afternoon. He tried changing hair products and even stopped wearing hats, but the itch stayed. When he had blood tests done for unrelated fatigue, doctors found high white blood cell counts. A bone marrow biopsy confirmed early-stage chronic lymphocytic leukemia. His scalp was the first and only part of his body, giving him a warning. What makes this sign tricky is that many older adults already experience dry or sensitive skin, so an itchy scalp can feel normal and get ignored. But cancer-related itching is different. It doesn't respond to creams or treatments. It lingers and nags, often disconnected from any visible skin problem. Also, skin cancers on the scalp, especially where hair is thinning, can start as small itchy patches. Sometimes these look like dry skin or tiny bumps. But if the itch persists in the same place and won't go away, it should be checked by a dermatologist under proper lighting. Because the scalp is hard to examine on your own, it helps to ask a spouse, caregiver, or a hairdresser to check regularly. If you have an itch that hasn't eased in weeks and it's not getting better, especially if you've been feeling tired, bruising easily, or just off, don't ignore it. Sometimes small, stubborn symptoms tell the biggest stories. Now that we've covered the scalp, let's turn our attention to the chest and breast area, another spot where persistent itching can signal something serious. Many older adults, especially women but also men, notice persistent itching around the chest or breast, often near the nipple or just beneath the breast. It's easy to blame this on sweat, tight clothing, or thinning skin from aging. But this area is one of the most overlooked places where itching can signal something much more serious, like inflammatory breast cancer or tumors near the chest wall. What makes this sign tricky is that the itch often shows up before any lump appears. The skin may feel warm, irritated, or tight. Sometimes it changes texture, becoming rougher, thicker, or reddish. But quite often, there is no visible change, just a deep, persistent itch that doesn't go away no matter what lotions or creams you use. For example, Ruth, 69, noticed an odd itching sensation around her right breast. She changed bras, switched detergents, and even stopped wearing a bra for a while, thinking friction was the cause. But the itch stayed in the same spot every day. When Ruth saw her doctor, slight dimpling of the skin was noticed, prompting further tests. They found a small but aggressive tumor growing close to the skin, without the typical round lump many expect. This is why inflammatory breast cancer can be so dangerous. It doesn't always follow the usual signs. It can look like a rash and spread quickly. The earliest symptom is often itching or irritation, not pain. Men might miss this sign even more, since male breast cancer is rare and often goes unnoticed. An itchy patch near the nipple, thickened skin, or a strange sensation under the chest muscle may not sound serious, but deserves a checkup, especially for older men. Also, this type of itching can be caused by swollen lymph nodes under the arms or near the collarbone, signaling lymphoma or another nearby cancer. If the itch comes with swelling, warmth, or a heavy feeling in the area, don't delay seeing your doctor. Early detection starts with awareness, listening to your body, and noticing unusual patterns. Now, let's address a sensitive but important sign: persistent itching in the anal or genital area. Itching in the anal or genital region is often uncomfortable and frequently ignored, especially by older adults. Many people feel embarrassed to talk about it and would rather brush it off. However, when this itching becomes chronic and there's no obvious cause like poor hygiene, infection, or irritation, it could be a warning sign of something serious. Persistent itching here may be an early symptom of anal, vulvar, or penile cancer. What makes this itch dangerous is that it often disguises itself as something minor. People assume it's dry skin, a reaction to toilet paper, friction from walking, or side effects of incontinence pads. While these are common causes, if the itch lasts for weeks or months, returns no matter how much you clean or treat it, and starts to feel raw or burning deep in the surface, it deserves medical attention. For example, Eugene, 76, believed he was dealing with hemorrhoids for nearly a year. Despite creams, diet changes, and cold compresses, the itching never fully went away. A specialist exam found a small lesion in the anal canal wall. It turned out to be an early-stage tumor, something that could have grown silently if not caught early. Vulvar cancer is rare, but becomes more common after age 60. One of its earliest signs is a recurring itch on or near the outer genital area. There may not be a lump, but the skin might feel rougher, slightly discolored, or thinner. Many women assume this is due to hormonal changes or postmenopausal dryness, and sometimes it is. But if the itching is relentless, worse at night, and does not respond to normal treatments, it should not be ignored. This area is rich in nerve endings and highly sensitive, often signaling internal changes before more obvious symptoms appear. Whether the change in skin cells, nerve inflammation, or swelling in nearby lymph nodes, chronic itching, especially on one side or in one small spot, can be a red flag. Unfortunately, many people hesitate to mention these symptoms out of embarrassment or fear of overreacting. But staying silent is more dangerous than speaking up. Talking about persistent itching can lead to early detection, better treatment outcomes, and peace of mind. As we wrap up, remember, your body is always communicating with you. Sometimes it speaks through pain or fatigue, but often it starts quietly with something small, like a persistent itch that keeps coming back in the same place. The 5 areas we discussed, the lower legs, upper back, scalp, chest, and genital region, are not random spots. They are places where serious internal issues, including certain cancers, often send their first signals. For older adults especially, learning to listen to these signs can make the difference between catching a problem early and letting it silently grow. You don't need to live in fear. This video is about empowering you, reminding you that your instincts matter. What seems small might be your body asking for help. If any of these signs felt familiar, don't ignore them. Talk to your doctor. Start the conversation. You deserve answers and peace of mind. Thank you for watching. Please leave a comment below sharing one thing you learned and how you plan to use it. Your thoughts inspire us. If you found this video helpful, please like, subscribe, and share. Your support helps us keep creating content to inform and inspire you. Thanks again, and see you in the next video.